Proactive risk management with 3M Prevena therapy aims to help advance the standard of care by helping to reduce the risk of costly postoperative complications, such as infection, associated with surgery in patients at high risk. In this video, you will learn a few tips and tricks to support safe and effective application of Prevena therapy on a closed incision after a groin incision procedure. Prior to use of Prevena therapy, consult detailed product indications, safety information, and instructions contained in the clinician guide. You will notice that the hair has been pre-operatively clipped to accommodate the area where the dressing will be applied. It is important that this area is clean and completely dry before application to ensure a tight seal. Once incision and peri-wound skin is clean and dry, apply 3M Cavalon No-Sting Barrier Film to peri-wound skin to prepare the area. To avoid tension or irritation on intact skin, use Prevena patch strips under the 3M Prevena dressing for protection. Avoid placing Prevena patch strips directly on the closed incision. For a larger patient, pull the skin back prior to application to avoid skin flaps under the dressing. Bend or taco the dressing so it rolls on easier when placing over the incision area. When using 3M Prevena Peel and Place dressing, center the foam over the incision, taking care to avoid sharp bends or kinks in the tubing. Place the dressing to allow for flexing and patient movement. 3M Prevena Plus customizable dressing can be cut to the size of your incision. Use the included extra hydrocolloid on the ends of the foam and wherever additional seal is necessary. No matter which 3M Prevena dressing you use, it's important to run your fingers around the edge of the dressing when applying and make sure to avoid stretching the material. Do not stretch the dressing or film during application, as tension can cause skin damage, such as tension blistering. With your Prevena dressing properly placed and sealed, you'll be ready to connect the dressing to a 3M negative pressure therapy unit, getting your patient ready for mobile recovery. If there is evidence of a leak, use Prevena patch strips around the dressing to ensure integrity of the seal. If you would like to learn more about proactive risk management with Prevena therapy, visit Prevena.com. For patient troubleshooting resources, visit 3m.com/Prevena for patients.